In Kenya, HealthRight started in 2005, and we mainly focus on 4 thematic areas: reproductive, maternal, newborn and child health, HIV, violence, and mental health. Mental health has become a global health issue, and more so with changes in environment, changes in economic and social situations. We thought mental health was a big public health issue that we needed to address as an organization. And that really also sets us apart from other organizations that are implementing health programs in the country.
In Kenya, especially for statistics that were carried out last year, showed that mental health, especially for perinatal women in the urban informal settlement, it's about 22.8%. And to be specific, in Mathare North, we had like around 1.8% of perinatal women going through postpartum depression. One main thing that we thought of having this in the informal settlement is the fact that there are so many issues that perinatal women experience during this period of conception, pregnancy, and after, that is up to 1 year.
As a county, we have a lot of strong grounds on private partnership, and we thrive on the partnership we have with other partners. And one of the main partners that we have is HealthRight Kenya, who came in about 3 years ago in the mental health space. They brought a project that was very unique, we had not done, that is a maternal mental health project.
Nakumbuka nikiwa na mimba wa mtoto, imekuja kibahati mbaya, mzee kwa nyumba amekuwa mkali, you have nobody to talk to, stress zikakuwa mingi, nikatoka from stress nikaingia depression. I tried even abortion so many times.
HealthRight venye ilikuja kwa kijiji yetu ilitusaidia sana. Cause mimi nilikuwa nimeanguka, so nilikuwa hadi natumia hizo drugs. Nilikuwa like mentally damaged na stress. Nilikuwa like commit suicide.
In our area, ukionekana uko na mental issues, people wanadhani maybe like umechizi, and majority they don't realize that they are sick. Because mental illness haiumi. Like for instance, depression, you won't feel the pain, but you are suffering inside. So like watu wako may accept kama ni ugonjwa until HealthRight ili chip in.
Ugonjwa wa akili ni ugonjwa unaweza kuaffect mtu yoyote, haujalishi uko kiwango gani. Hata mimi mwenyewe sikuwa najua kwamba hiyo shida ya akili ina affect kila mtu. Juu hapo pia mimi nilikuja kujigundua kwamba hata mimi nilikuwa na hiyo shida ya akili.
Mimi hakika nilikuwa mbali sana. Wakati nilipatikana nikuje niingie kwenye hiki kikundi, hata mara ya kwanza singezanga hata kuongeanga na mtu. Machozi ndio ilikuwa inatiririka kulingana na changamoto yenye nilikuwa napitia.
Situation hapo awali kabla HealthRight wa intervene ilikuwa wasi sana. Hakuna programu yote ile ilikuwa incorporated na government ya kutackle mambo na mental health. Ilikuwa ni shida kubwa sana juu sisi tulikuwa tunaona wengine maybe wakikuja clinic, unaona vile mama na behave, unasema huyu ni kama wazimu.
Initially, we didn't have any mental health professional. When HealthRight came in, the first thing they did was to train the healthcare workers so that at least they get orientation on how to assess this client, what to expect, and how to manage.
Initially, I went through MHGAP training. In that training, you're taught about all the mental health conditions, including depression, psychosis, epilepsy, and also drug abuse. I was able to go through interpersonal therapy training. Basically, we were focusing on maternal depression, that is for pregnant mothers and those who also have children under 1 year. And what we were doing, we wanted to identify what are the causes of this depression.
So at least when you go to the NC department, you'll find the nurse there like doing some screening for the mental health services. You go to maternity, the same thing happens. Outpatient, the clinicians there are well conversant with the mental health conditions, so they can screen and they can as well prescribe, or they can even do the psychotherapy.
So after how kukuja, ndio tukaanza ku-address hizi issues in a positive manner. So mama alikuwa anakuja, unamuelewa kulingana ile training uli-undergo. Kuna ile form tunatumia kuscreen ilikuwa inaitwa PHQ2. Kuna questions mbili na unamscore. So akiscore sana, huyu mama anapitia depression, so unamrefer kwa psychiatrist ili aweze kusaidika. Na kama yake iko chini, tulikuwa tunaweka kwa IPTG sessions.
We used to come up with a group of 6 mothers with different challenges, but all of them, they are still undergoing depression. We identify these mothers have depression through HQ9. After that, we were able to classify their issues. Is it conflict? Is it loss? Is it role change? And out of that, we were able to take them through to understand that they are suffering from depression, and these are the causes, and this is the things that they need to do to get out of depression. But in cases where we find that this mother has got suicidal thoughts, or maybe they have had suicidal attempts, definitely they just needed to be seen by a psychologist. And in one situations where we feel that this mother really need maybe an admission, we tend to refer them to Mathare Hospital.
Watu wengi wameanza kujua stress ni nini, depression ni nini. Nawaambia jinsi yenye mtu mwenyewe unaweza kisuia usifikie hiyo mambo ya depression.
We've had involvement of the CHVs who follow up these mothers, and HealthRight have really been part of this capacity building our CHVs to be able to respond to the maternal health needs for our mothers when in their community.
We are seeing at least more than 1,000 individuals seeking services at the facility, mainly because we have community health volunteers at the community who actually refer the community members from the community to the facility and assuring them that there are services, especially like counseling or psychosocial support, being offered at the facility.
Sidhani kama ningekuwa kwa hii dunia na huyo mtoto wangu. HealthRight imenisaidia sana juu ilinitia hapo mahali mpaka nikaona kumbe hii stress iko na dawa inapona. Saa hii niko sawa.
Nilikuwa like commit suicide. So nilikuja nikakutana na one of a CHV of which alinishika mkono akaniguide. Nikakuja nikafika time zile negative thoughts zenye nilikuwa nazo zikaanza kuwa positive. La committing suicide nikajua still kuna life, and sijavunjika mikono na miguu, still I can hustle. I now know how to handle my situation in whatever way.
Personally pia wanatulipa ambapo shida zile nilikuwa nayo naweza tatua, na pia kuangalia jamii at large, hata mandugu zangu, madada zangu wakati wanapitia magumu naweza kuwafunza na wanakuja kutatua hayo mambo kwa njia inayofaa na wanajikubali. Imenisaidia mimi kwanza kama Catherine. Pia kwa jamii imetusaidia sana.
We have seen women come and talk about being, free of the depressive symptoms. One of the most touching thing is when you have instances when a woman tells you that if it was not for this project, I was planning to kill myself, to kill my children, I'd given up hope in life. And it has been a success, and so far we have more than 300 women who are taken through the group therapy, and about more than 3,000 who were in contact with mental health information at the community level.
We've been having challenges here and there when implementing the project. The fact that we've been trying to integrate mental health within the primary healthcare, we've been able to identify that key issues. Most of the healthcare providers don't have the information or awareness on mental health. We have to come in and train to bridge the knowledge gap and ensure that we have key people who can support within the target facilities.
This was a new intervention in Nairobi. It was really resource intense, which had not been projected when the project was being designed. We had a bit of delay because in health, when you're bringing in an intervention, we have training of master trainers, training of trainer of trainers, then the implementation and supervision.
Finding a space of an area to serve the clientele that the rate had started going up was a challenge. I remember approaching the HealthRight team to assist us with a tent, of which they did.
Watu walikuwa wanapuuzia wakisema kwamba hatuoni umuhimu wake. Hiyo ndio kitu ambayo ilikuwa kitu ya pili. Watu wanakuwa nasema kwamba tumezoea, ni kama COVID-19 ilikuja, watu wakafaidi na wakafanya nini? Wakaenda. Hizo ndizo challenges ambazo tuliona watu wengi walikuwa wanapuuzia.
Na wakati unaenda kwa households, unaenda unaambia mtu, kwanza nakuuliza umeniletea nini? Changamoto yangu kubwa, sina chakula, sina kazi, sina nini. Una expect wewe ni kuongeleshe ama ni hii mambo inanisumbua kwa nyumba. Aya, saa zingine ushamuelezea vizuri akajua. Unaangalia level yake sasa ni ya umemrifa, saa zingine aende hospitali, haendi.
But the other challenge was there is at the community level. We are still at a space where we have a lot of stigma and discrimination towards mental health. People don't want to come up to talk about their emotions, their moods. For someone to come and tell you that I feel like killing my baby, I feel like ending my life, I feel like I want to sleep and not wake up. Africans, we are not very good in that. So one of the challenges was about stigma, acceptability, but we are yet to accept that mental illness is real and we have a challenge at the community level.
The project has had a lot in the process, the challenges and the achievements. All that has enabled us as the organization to learn a lot about the implementation of mental health within the community. And one of the main things that we've learned is health system strengthening. There's need for organizations to come in and strengthen what already the government has put in place. So we ended up using the MOH 100, which has been a referral tool at the community level used by CHVs. And this has really strengthened the referrals from the community to the facility level.
HealthRight has played a key role in the creation of a roadmap towards integrating mental health in the mainstream services, core services of the county.
Actually, from the baseline, there were no psychosocial support services at the facility. With the psychologists being attached at the facility, then we're having at least one psychologist at a facility, but previously they were not there. We are also seeing in terms of numbers that we're having healthcare workers at the health facility, and like previously they were not there. Previously there was 0, now we are having 2, which is good for us, where at Embakasi we have 1 and Ruaraka we have 1.
I think we've done very well because through the support of this project, our clinics became robust because we had a lot of community engagements. CHVs trained on how screening, identifying and referring, doing household visits and specifically targeting perinatal women. And apart from that, we had a lot of community clinics who were doing community dialogues, a lot of community sensitization, which really improved uptake of mental health services, and it led to growth of our clinic.
We've seen the innovation also, the electronic referral, the app that they are coming up with, where we can be able to have the referral done from the community, and it's notified to the provider that a referral has been done, and when they report to the facility, this is also triggers another communication that the client has been attended to, and again back to the community, we are able to follow up on that client.
It's very unique, and it's going to change the way we implement projects, not only here in Nairobi, but also in other parts of the country.
Imenisaidia mpaka kucope up na maisha, kucope up na marriage. It was very difficult. I cannot accept some things, life in a more.
Still pia wanaume huku nje mayouth, si wanawake peke yake. Pia huyo mwanaume ako at a very high risk pia ya kupatwa na depression. So still pia wao watakuwa na ile furaha ya kusema pia sisi kuna mradi, hebu hata sisi wote tujitokeze.
From the impact that we gave the community health workers, the knowledge, it has brought a lot of change in the community. The mothers they are seeing are also able to refer others.
Kuna venye nimesaidia majirani kidogo kidogo. Ukiona ako kama wewe venye ulikuwa awali, nikimwongelesha naona ninampea morale.
Mental health is very critical when it comes to the human aspect. A client can walk into a health facility and they don't really need much. They only need that one person they can just talk to. This healthcare person would understand them, be in their shoe, listen to them and give them advice, and the client will go home very happy.
And we are so happy because the passion that we are seeing in these individuals that we've been working with, the CHVs, the mental health champions, it's very encouraging, and we are very sure that everything is going to continue.
One of my sustainability goals in every project that comes on board is capacity. We were able to train 8 trainers, TOTs. I'm a master trainer in this, and we have 32 facilitators who are county-owned, some of them being the community health volunteers. So when you look at sustainability, we have capacity already in us.
Even as we look towards the project closure, we are happy that we have impacted the lives, we have done a lot. We look forward to seeing better results, and hopefully that we'll be able to have more support into ensuring that we scale up this project. It's impacting a lot of lives.